I'm Sion. I'm a student physical therapist at Regis University. I'm here with Zach. We're going to be looking at some thoracic spine evaluation techniques. We're going to first look at range of motion. So Zach, I'm going to have you cross your arms, and we're going to have you bring your shoulder all the way down to your hip, laterally flexing for me. Good. Does that feel okay?
Yep.
All right, we're going to add a little overpressure. How's that?
Still feels fine.
All right, and we'll have you go the other direction for me. Does that feel okay?
Yep.
All right, and how is that?
Good.
Good. All right, now I'm going to have you keep the same position, and you're just going to rotate all the way to one side for me. How does that feel?
Good.
All right, we're going to add a little more pressure. Is that okay?
Yep.
All right, in the other direction. And how's that?
Yep, still
Good.
fine.
And just for the camera's sake, I'm going to have you slide down to the end and face this way. We're going to be looking at flexion and extension. So I'll have you cross your arms again, and I want you to round your shoulders forward as far as you can now. Does that feel okay?
Yep.
All right, add a little bit of pressure. How's that?
Good.
Good. And now I want you to cross your elbows so that they're stacked on top of each other. I want you to bring them all the way to the ceiling, back as far as you can.
Okay.
Does that feel okay?
Yep.
Good. And I'm going to add a little more pressure. How's that?
Good.
All right, and you can go ahead and relax. Now we're going to be looking at first rib motion as he naturally breathes. So first let me go ahead and palpate those. Is that comfortable?
Mm-hmm.
All right, I want you to just go ahead and take a deep breath in. Good. Have you do that one more time? Good. Go ahead and relax. All right, now we're going to be looking at the function of the thoracic cage. First, we're going to be looking for that pump handle motion in the sagittal plane as the ribs elevate when he first inhales. So to find that angle of gluing, go ahead and take a deep breath, Zach. Good. Drop down a few segments. Go ahead again. Good. Seeing some good symmetry each time. And one more for me. Good. And as he inhales, those lower ribs are actually going to expand to the frontal plane like a bucket handle. So we're going to check for the symmetry of just the placement of the ribs to start, and then have you do the same exact same thing. Good. And again. And one last time. Good. And then finally, we're going to be checking the mobility of that first rib. We're going to be using the spring test. Just going to go ahead and move that trap out of the way. Take up the slack, and we're just going to direct some pressure towards that opposite hip. Feel it as it depresses and as it comes back. Okay. All right, we're here with Zach. He's lying prone. We're going to finish our examination of the thoracic cage and how it moves. We're going to be doing that rib angle spring test. So I'm going to go ahead and start. I'm going to palpate that 12th rib on both sides, check its symmetry. And then just glide it, feel how it returns. And once that scapula kind of obstructs my motion, usually about T4 area, I'm going to go ahead and switch side and compare bilaterally. How are you doing, Zach?
Doing great.
Find that 12th rib angle. Still doing all right, Zach?
Mm-hmm.
All right, so those move good. Now we're going to go ahead and check the thoracic vertebra. If I could have you go ahead and extend, neck, perfect. Just to ensure we know where C7 is, and then we can find T1. Just palpate that spinous process prior to translating it. Just feel how it glides and the characteristics of how it returns. shape and orientation of those joints on the vertebra. You're going to be changing your pressure on the spine. Still doing all right, Zach?
Mm-hmm.
All right, and you can go ahead and relax.